Hello, dear student. Myself Arif Khan welcomes you all in the fifth part of the antibiotics. In this part, we will see the non-beta-lactam antibiotics. Previous, we had seen the beta-lactam antibiotics. So, in this part, we will see the non-beta-lactam antibiotics. So, in this first subclass is aminoglycoside antibiotics. So they are named as aminoglycoside because these are glycosidic in nature, and we know that the glycosides consist of the sugar and non-sugar part which are linked glycosidically. So like same, this has a chemical nature that is glycoside and which has amino sugar, that's why it is called as aminoglycoside and antibiotic. So they are so named because their structure consists of amino sugar linked glycosidically. They contains highly substituted 1,3-diaminocyclohexane ring, and hence they are strong basic compounds. So this is a say glucosamine, which we are calling amino sugar and amino sugar part, because when we are talking about the glycoside, so it will have the sugar part, that is amino sugar is there, that's why aminoglycoside antibiotic is there. So this is exactly the amino sugar that we call a D-glucosamine, which is an amino sugar present in these all types of aminoglycoside antibiotics. Now we will see the typical example of these class, that is aminoglycoside. The first and typical example, streptomycin. Okay, so as far as the chemistry is concerned, streptomycin, it is called as aminoglycoside because it structurally consists of amino sugar linked glycosidically with the aglycone part. So it contains the three basic part. If we are talking about the streptomycin, we'll have the three basic units, namely streptidine, L-streptose and N-methylglucosamine. So as per this structure, we are going to deal. So this is the streptidine. The first topmost part is called as streptidine, and actually it is an amino acid. It is an amino acid which is a non-sugar part, amino acid. And next one, that is the L-streptose, and last one bottom indicate the N-methylglucosamine. So this contain the next image also the same thing, that this is the structure again of streptomycin, which has a first part, that is streptidine, which is an amino acid, then middle part is called as L-streptose, and last is called as N-methylglucosamine, which is a amino sugar part. So amino sugar part is linked glycosidically, and hence it will give its chemical nature, that is aminoglycoside. So this is streptomycin, one of the typical example. Now physical property is concerned, it is white, odorless, bitter powder, and very soluble in water. Stability storage of streptomycin, it is stored in tightly closed light resistance container and protected from moisture, temperature not exceeding 30 degrees Celsius. And if it is intended for parenteral use, the container should bear the sterile, and it should be sealed so that it should exclude the microorganism, means it should follow the sterility criteria. Uses of streptomycin, it is a broad spectrum antibiotics, and it is an antibacterial and used in the treatment of orally, used in the treatment of intestinal infection of the large intestine. Sometimes colitis, like that is the infection related with the large intestine. So in the treatment of that infection, we are using this streptomycin. Intramuscularly, for the treatment of tuberculosis. For the tuberculosis, streptomycin is the most popular antibiotic, most preferable first line treatment of tuberculosis. We are using these streptomycin antibiotics. Sometimes intrathecally means it is to be injected in spinal cord. So for the tubercular meningitis, so when tubercular infection reaches to the meningi and causes the tubercular meningitis, in that case the drug to be directly administered in the spinal cord, and meningitis, that is called as intrathecal administration. So streptomycin can be used for the treatment of tubercular meningitis. In the treatment of non-tubercular infection like cholecystitis is nothing but what? It's an hepatobiliary obstruction type of infection, hepatobiliary obstruction, which may concern with the liver and biliary duct. Pharmaceutical formulation: streptomycin tablet, injection, chlorostrep, enterostrep, lycastrep and streptomax. These are the brands for the streptomycin types of antibiotic or streptomycin antibiotics. Next example we are going to see, that is amongst the aminoglycoside antibiotics. First was streptomycin, next again a neomycin. So it is an again aminoglycoside antibiotic produced by the Streptomyces fradii. This is the microorganism from which this antibiotic can be obtained. So this is the biological source or microorganisms from which the antibiotic is obtained, that is aminoglycoside antibiotics called as neomycin. It is a broad spectrum antibiotics, and which is a mixture of three components of neomycin A, B and C. These are the say polymorphic form of the neomycin A, B, C, and when we are obtaining neomycin, maybe a mixture of all these three forms. Then as far as the physical properties, it is a white, yellow, white, odorless, bitter powder, crystalline powder, as well as hygroscopic in nature and freely soluble in water. Chemical properties, when it is this substance is treated with the in a pyridine and heated with a ninhydrin solution between the temperature 65 to 70 degrees Celsius for 10 minutes, it will give the deep violet color. That is due to the presence of amino acid. Just we had seen in case of streptomycin has a streptidine as amino acid. So amino acid will show the ninhydrin test positive. So this is again the amino glycoside types of antibiotics will have a amino acid part residue in its structure, and due to presence of these amino acid, it will show the ninhydrin test positive. And wherever the amino acid react with ninhydrin will give the violet color. That is the same popular test for the amino acids. So this again will give the amino acid test positive because it have amino acid in its structure. Next, as far as the uses of neomycin is concerned, it is a broad spectrum antibiotics and used in the treatment of staphylococcal infection of skin and eye, as well as the GI tract infection on the oral administration. It is used in the patient suffering from the hepatic coma, or is also called as hepatic encephalopathy. For the treatment of hepatic encephalopathy or hepatic coma, that to suppress the ammonia forming bacteria in GI tract. Sometimes these ammonia forming bacteria or flora will produces the ammonia, and that is not being failure for metabolize the ammonia by the liver, that leads to accumulation of the ammonia. Increased level of ammonia will get mixed up with the bloodstream and will cause the brain damage, or will produces the toxic effect to the brain, and that results into brain damage. So it starts from liver but reaches to the brain and will damage the brain, is called as hepatic encephalopathy, and that is due to the growth of the ammonia forming bacteria in liver. So these actually antibiotic will kill these ammonia forming bacteria, and it will basically will cure the cause of these hepatic encephalopathy, and that's why it may be in the treatment of hepatic coma. Next, the formulations are neomycin cream. It's available in mostly the topical formulation as well as hydrocortisone. Neomycin cream means with the steroid. The hydrocortisone neomycin eye drop, then eye drop again, neomycin eye drops, plain neomycin and hydrocortisone eye drop, neomycin eye ointments. So in ophthalmic form also it is available, as well as topical in the form of cream it is available, and injectable form also it is available. So these are all the formulations of neomycin. Brand names: Dexabur, then Dexacort, and Nebasulf and Neosporins. These are the most popular brands of the neomycin. Next, gentamicin. So there are three examples amongst the aminoglycoside types of antibiotics. First one was streptomycin, second one was neomycin, and third one this we are going to deal, that is the gentamicin. So it is again the aminoglycoside types of antibiotics and produced by the micromonospora purpurea. So this is the microorganism which produces the gentamicin by fermentation process. So these are the microbiological source of this gentamicin, micromonospora purpurea. Next, physical properties: white, cream, odorless, bitter, hygroscopic powder, soluble in water. Stability, storage condition as usual. It should be stored in tightly closed, light distance container in a cool place. Uses: it is used in the treatment of septicaemia including neonatal sepsis. Neonatal stand for infants or related with the infants. There is a sepsis if there is an infection, systemic infection in concerning with the neonates or say infants. This is called as neonatal sepsis. So for the treatment of these, one can use the gentamicin as antibiotics. Then other severe systemic infection due to sensitive gram positive and gram negative bacteria, one can use it. Also used in the prophylaxis and the treatment of endocarditis. It is also being used in the prophylaxis of surgical infection. Prophylaxis of surgical infection means before undergoing the surgery, major surgical operation, it to be started as a prophylaxis, because many times the surgical operation the tissues are being invaded or cut, that may leads to during the recovery, or stitches are given during the recovery, there may be chances of infection. So in that case the antibiotics is started just before the before going the major surgical operation, that we are calling a prophylaxis of surgical infections. So it is given in conjunction, or that is in combination with the other antibiotics to delay the development of the resistance also. Sometimes any of the antibiotics are producing resistance, so in that case it is like this gentamicin will be given in combination with that antibiotics which may able to produce the resistance. So in that case there is a delay in the development of resistance. So next, pharmaceutical formulations are injection, cream, ointment, eye drops. Wide varieties of formulations are there: gentamicin, G-mycin, and gentapar. These are actually the brands for the gentamicin, the aminoglycoside types of antibiotics. Now next class, amongst the non-beta term, that is the tetracyclines. First we had seen aminoglycoside, in which we had seen three examples, that was streptomycin, neomycin, and gentamicin. Now we are moving toward the next subclass or next type of these non-beta lactam, that is tetracycline. So why we are calling tetracycline? Because having tetra means four cyclic rings. Tetracycline, four cyclic rings are there. And basically when we are going to see this structure, this is a basic structure of the or common structure of all say tetracycline types of antibiotics. Basically two benzene ring fused together, that is called as naphthacene, and there is a say saturation, that's why it is called as hydronaphthacene. So if two benzene ring, one naphthacene, again two benzene ring, another naphthacene, so it will be a naphthacene derivative or hydronaphthacene derivative, we can say that. That's why this was a structural feature. We'll see the biological source of this tetracycline. It was produced by Streptomyces remosus. So this is the say biological source of the tetracycline, which is produced by Streptomyces remosus microorganisms, or the mold which produces the tetracycline by the fermentation process. Tetracyclines are octahydronaphthacene derivative. Just we had seen octahydronaphthacene derivative, and it is a say broad spectrum antibiotics. This is the general structure of antibiotics, that is a tetracycline, just we had discussed. Next, as far as the physical property is concerned, it is odorless, bitter crystalline powder, very slightly soluble in water, has a slight solubility due to increase in the number of rings. Number of ring increases, number of carbon increases, and the leads to a non-polarity, and that results into a making it very slightly soluble in water. Water solubility got decrease. Next, stability storage, it should be stored in tightly closed dry distance container. If it is intended for parental preparation or parental use, the container should be sterile as well as sealed, so to exclude the microorganisms. This is called a sterility parameter, sterility criteria. It is to be followed when it is to be injected, and label on the container should be not to be injected if it is not for injectable. For if it is not for parenteral administration, then there should be a clear instruction not to be injected. So this was the say labeling instruction. Now as far as the uses of tetracycline, it has a wide spectrum of antibiotic and activity, such as for the treatment of chronic bronchitis, bronchial infection, chronic bronchitis, inflammation of bronchi due to the infection, respiratory tract infection, as well as urinary tract infection. It is in the treatment of syphilis, gonorrhea, which are actually the STDs, sexually transmitted disease, in penicillin hypersensitive patients. Wherever there is a say penicillin is not effective, or penicillin showing hypersensitivity, or any of the adverse reaction or hypersensitivity reaction, in that case penicillin got replaced with these aminoglycoside, with this tetracycline, and used in the treatment of syphilis, gonorrhea. Acne vulgaris, simply it's a acne, or acne we are calling acne vulgaris also. Next, in combination with the streptomycin, these antibiotic tetracycline is used in the treatment of plague. In combination with the fluid electrolyte replenishment, it is used in the treatment of cholera, because we need to kill the bacteria, as well as say there should be a electrolyte and fluid replenishment therapy also in combination, because there is a severe dehydration in case of cholera. So antibiotic with the electrolyte replenishment. Next, in combination with the quinine, it is in the management of the malaria also, resistance for chloroquine. If it is being developed resistance, so this antibiotic is given in combination with the chloroquine or quinine, and to treatment of the or the management of the malaria. Next, in combination with the amebocides, it is in the amoebic dysentery also. Amoebocidal agent, other amoebocidal agents, with this the combination of this tetracycline. That's why it has a wide variety of uses, and we had mentioned that it is an broad spectrum antibiotics. Okay. Next, the formulation of tetracycline: capsule, tablet, injection, eye ointment, then procaine injection, tetracycline with the procaine injection in combination, and the intravenous infusion. Infusion means the maybe in a large volume parenteral LVP from infusion it is available. So tetracycline available in that formulation also. Next, acromycin, enterocycline, and cardiocycline. These are the actually the brands for the tetracycline types of antibiotics. So in this way we had seen the two major classes of the non-beta lactam antibiotics. First one was the aminoglycoside antibiotics, and next major class, that is a tetracycline, which is itself a typical and prototype example of the tetracycline class. So the next non-beta lactam antibiotics we'll see in the next part. Thank you so much. Thanks for watching.